The reason for sponsoring this bill to amend the Federal Medical Center Act and the establishment of Federal Medical Center in Kwale, Ndokwa West local government area of Delta State, was basically on the need of the people having lived there for many years. And I know health is important to every government. You also agree with me that the Federal Medical Center in Asaba is little distant from Kwale. So that necessitated my sponsoring of that bill. And when assented to, it also gives succor to Ndokwa and this environment. Because the populace in Kwale, you know, Kwale is a metropolitan city where different tribes reside on. And for Kwale to, at this level, without FMC, is uncalled for. And that is why I said it is important I sponsor this bill so that our people will have access to health care and also enjoy government presence, because when this is established, a lot of people passing through pressure of traveling distance from Kwale to Asaba will no longer do that. And that is the major reason, and I'm happy that Speaker also agree with this bill, and this bill will get the light of the day. You must first of all amend the Act to accommodate the Kwale Federal Medical Center. Because without amendment, you have to amend the clause that stipulates the number of federal medical centers in the country. So when that is not done, you cannot just move up and say you are sponsoring a bill without amendment. So that act of numbers of federal medical centers is to allow us, or to allow federal government to include Kwale as one of beneficiaries of federal medical center. Of course, this is it will be very important, and the people will be very happy, because a lot of them, the private clinics are also very, very exorbitant, and a lot of our people cannot access private clinic unless on critical situation whereby there is no way. And someone, for instance, having a very critical challenge, before traveling from Kwale to Asaba, that person might also face with a lot of effects of that distance. So somebody that needs to be attended to urgently, when the thing is established, it gives help to our people, because Kwale is one place that is the number of persons staying there very much, and the people will be very happy, because a lot of things like the children, pregnant women and all that, they will have access to health care. A lot of things in the federal medical centers, some drugs are administered to people freely, you know, but we don't have such in Kwale. So with this bill, I know our people in the Federal Constituency and the community will be very happy. Utagbo as a whole will be very glad, because they are not just going to be the only beneficiaries of this establishment. It is the Kwale and environs. And the environ, both the Hausas, the Yorubas, the Igbos, every people are there in Kwale. It's a very big city that need to have Federal Medical Center in that place. So the people will be glad, because they know that is one of the requests. During the election, they said they have been suffering lack of health care. And I know that I've tried as much as possible to see how this bill will have the light of the day. So to be frank with you, my people will be very glad. Everybody, all sundries, will be very happy. For we to have reached this level of this bill coming out for second reading, I must tell you I've done my homework. I'm a team player. and they know the leadership of the House and my entire colleagues know I'm a team player. I'm one of those that support people's motion, my colleagues' motions and bills. So when anything coming from me, you need to see the ovation in the House today. Everybody said yes, 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 yes. You know, at the time they asked me, hey, so don't even go further. It's important we establish a Federal Medical Center. And the leadership of the House, the Speaker, my boss, Honorable Nnamdi Abbas, PhD, he also mandated the clerk as the procedure demands to allow the bill for second reading, which was also read in the floor of the House. So